Well, first of all, I would like to say that we are really excited about being awarded the Connecting Healthcare Innovation Award. Thank you very much. The Dreamcatcher is an innovative digital tool which aims to inspire young people with rheumatic diseases to express their dreams, and then with support from healthcare providers, be able to make their dreams come true. The Dreamcatcher focuses on health and possibilities rather than sickness and limitations. Both patients and healthcare providers have reported that they lack a tool that enables like a structured patient conversation. And this is where the Dreamcatcher is needed. It's a tool that enables participation for patients and commitment as well for both patients and healthcare providers, so that patient-centered care can become a reality. So the Dreamcatcher has been developed in collaboration with all of us, the Swedish National Organization for Young Rheumatics, or Unga Reumatiker as we're called in Swedish, the organization that I represent. And we've done it together with the pharmaceutical company Pfizer and Swedish rheumatology specialists and communications experts to ensure that we co-create a comprehensive solution that works in everyday life for both patients and healthcare providers. Well, the most important thing with the Dreamcatcher is the focus shift from limitations to possibilities. We are talking about empowering patients and making sure that our goals and our dreams are the main focus in encounters with healthcare professionals. And then I'm sure the healthcare professionals also have their own view. So Susanne, would you like to give yours?
Indeed, we have representing a rheumatology clinic with adult patients. I must say that this project has really changed the way our healthcare providers interacts with the patients, with the young patients. They ask different kinds of questions that are usually asked to our patients, and the patients are much more active and included in the conversation. And very important, our healthcare providers now have a much better understanding of the importance of focusing on the abilities, possibilities, and dreams of the patients rather than, as we usually do, focusing on the problems and obstacles and disabilities. So this is really a change in our way of meeting with the patients. And I'm sure that the pediatric rheumatologists have something similar in their experience. So Karin, what would you say?
Well, I think I really agree with what your experiences. I think that this project provides a tool that we've been longing for a very long time. So with a better knowledge about patients' dreams and goals, we care providers can also give better care, because we can focus what is really meant for the patient. And hopefully this adds more meaningfulness and value with the meeting that we have together. And hopefully also leads to a higher motivation and patient taking more active part of their own medical health plan. And I think that this goes also for very young children, that usually the patient's parents takes more part of the room and the meetings. But I think that this really gives opportunity for the child also to take place in the meeting. And we really can, even in the pediatric environment, also have more patient, child-centered care. And this I really look forward to.
Yes, like Kim mentioned, the Dreamcatcher is the collaborative project between patients, healthcare providers, communication experts, and Pfizer. And as it is a complex collaboration project, important is that we do this with integrity, respect, and transparency. And in order to prioritize real needs and behavior, the solution was to co-create with the patients and healthcare community. Maybe you, Victoria, can explain a little bit further how we did this.
So we started with a shared vision around the patient, and this commitment played a huge part in the success of the project. So as she said, the keywords were transparency, openness, and the user in the center. And we made sure that everyone could easily get access of all information that's user insight that we gathered through the studies. The innovation is co-designed with actual patient and real healthcare professionals through workshops and in-depth interviews. So this way, we made sure that real needs and a user-centric approach was the key element of the process and also our guiding light throughout the whole project.
Yes, transparency is a key component, I would say. We made a decision that all insights, data, and information should be shared with all stakeholders, and we created a plan for how this should be shared. And in addition to regular meetings and follow-ups, we also had frequent status reports where everyone could easily access relevant information and data. And I think this is what empowered everyone in the project to make data-driven decisions and created a strong trust between the partners.
I would say definitely to make sure that you include the patients in the very beginning of any planned project. If you do that, you don't risk wasting time on something that is not of interest or considered a problem even by the patients. And also never ever underestimate the knowledge and experiences of the patients. Really respect how they have gained their experience. So that would be my piece of advice. Karin, what would you want to share?
Well, definitely, I agree with you, because traditionally we healthcare providers make the best of effort to develop healthcare that we think is the best for our patients. But without the patient's own perspective, we seldom reach the real goal. So personally, I would never waste any time on any project concerning patient without collaboration, including patient's own perspectives from the start. Because I think really the collaboration is the key for real value. Or what would you think? Do you have anything to add, Victoria?
From a communication perspective, and I come from the design and communication company, for us, I would say that it's important to start with a shared vision and a shared commitment from the whole team. So when you embark on a journey, you need to clarify the bigger picture for the whole journey. So think big, but start small. So this way you can learn together along the path as a team instead of working towards a predefined solution. So that was a way that we could find this innovative solution. So Ulrika, do you have anything to add?
Yes, I completely agree with you. One important factor is to ensure that the project is based on real patient needs. We need to involve the patient in every step of the process and to make them co-creators of their care. This project is based on open source, which makes it scalable and can potentially be used for other patient groups as well. That's another advice I have to give to see the bigger picture, that maybe it could be used for other areas as well. And Kim, over to you.
Yes. Well, I would just want to say again one more time that I really think that the most crucial part for this project's success has been the collaboration. Every partner has been absolutely vital to this project, and we could not have done it without each other. And then, of course, I agree with what you've already said, and the advice that I always give is to make sure that the patients are the ones that are setting the agenda. You can't create a tool for patients and believe it to be successful unless patients have been involved with every part of the process. So that's the advice I always give, and even more so now. Thank you.